Hello, and welcome to, I believe, the 8th in our weekly update about coronavirus and what's happening in Stanford with relation to the coronavirus. We've been doing this every Tuesday at 6 o'clock live since before Thanksgiving. So let's get started with what we have today. Our agenda for today is, first of all, I will give some top-line numbers, and then the vaccination update and a very exciting expansion, which has just happened here in the last 24 hours, will be given by our Director of Public Safety, Ted Jankowski. As I think everyone knows, but sometimes we forget because the world changes so rapidly, there is a new federal stimulus and relief bill, and our Director of Economic Development, Thomas Madden, will share with that. And then finally, I'll go over some of the other numbers and reach our conclusion for today. That's the story, but it is rather exciting in terms of some of the updates that we've got on the vaccination front. With that, I start out with the national total of fatalities from COVID-19. As of this morning, 376,000 total U.S. fatalities from COVID-19. That is, more people have died of COVID-19 than both our U.S. Navy and our Coast Guard active duty people in service to protect this country around the globe. Both the Navy and the Marines combined is less than the number of people we've lost to COVID in the last year. In the state of Connecticut, our new cases per day, this is the overall trend all the way back from March, where we had our first peak back in the spring, and then it dropped off, and then it started rising in late September, early October. We hit this peak right after Thanksgiving. We think a large part due to the family gatherings at Thanksgiving. It came down again, but now we're seeing a peak again. We are now just about 10 days, a little bit more than 10 days out from the Christmas to New Year's break, and we're seeing that increase in cases. Across Connecticut, 2,675 new cases a day on average over the last week, and a 55% increase since the day before Christmas. That's how much it's increased over that time period. And this state suffered 248 fatalities in this last week since we last spoke to you. Here in the city of Stamford, here is our overall cumulative cases. As you can see, we started up very steeply in March, but we're able to stop that steep rise and, as they say, flattening the curve. And we had a very gentle increase in cases, basically from May through June, July, August, September, and well into October. But in the middle of October, those cases started rising again, and that rise continues today. When we look at the new cases in Stanford, focusing since September, these are the low numbers that we had in September, October, and in fact through the middle of October, and then they started rising. These peaks basically are roughly the same peaks that we see across the state of Connecticut. Not the same as is happening elsewhere in the nation, and certainly not to the same degree. But as you can see, we had our peak after Thanksgiving. Here it is, a little bit of a peak just before Thanksgiving, and then it fell off. And then after the Thanksgiving holidays, we had a peak here. Then it's dropped off, and now we're rising just like the state of Connecticut. We now have 108 new cases being reported on average over the last 7 days. And it's been a 51% increase since December 24th. Not quite as bad as the state of Connecticut, but the difference between 51 and 55 is small when you're talking about 50% increases in the number of cases. And unfortunately, the death toll continues to mount here in Stamford, as in the state of Connecticut, as the country. In this city, we had 3 fatalities due to COVID reported last week. That's kind of our top line numbers for this week in Stanford. And with that, I'm going to turn it over to Director Ted Jankowski to talk about our vaccination status here in Stamford. Ted?
Thank you, Marion. Good evening, everyone. The mayor said, there's some good news, and we are going to be advancing. But right now, we continue in phase 1A, where phase 1A is that very high risk and frontline workers. It's the healthcare workers, first responders, our COVID-19 vaccinators, and long-term care. That's something that we began here in the city of Stanford on December 24th. And next week we will be start giving the second dose. And in the city of Stanford here in our Department of Health, we've been utilizing the Moderna vaccine. But the good news is that we have petitioned to the state based on the vaccine that we had available, and they did open it up to the 75 plus group. So it's a positive, and we actually sent out a press release today asking our residents to sign up. Phase 1B, Mayor. Phase 1B, the governor has mentioned that will be starting this Monday. That will include that 75 plus group, as well as some other essential workers. And phase 1B is going to continue to phase in the groups as it progresses, because you're talking about thousands of individuals who will need to be vaccinated. One good thing, Mayor, and I appreciate your leadership. We continue to push for as much vaccine as possible. So we are all hands on deck, and we are trying to administer as many vaccines as possible. The only limitation is that we need more vaccine to administer. The next phase is, Mayor, phase 2 and 3. Phase 2 is people increased risk of acquiring or transmitting COVID-19, and then people with limited access to routine vaccination services, as well as a small section of the general population. And then phase 3, that's when we have the general population, and everyone in the city of Stanford will be eligible to receive a vaccine. Next slide, Bear. So the vaccination status as of today, Stanford Health, which is Stanford Hospital, has administered over 4,300 vaccines, and their focus has been on the healthcare workers. And believe it or not, they actually started giving their second doses last week. They started their vaccination program 7 to 10 days prior to us, and they were administering the Pfizer dose. And the Pfizer doses, the time period between the first vaccine and the second is less than the Moderna. That's a 3-week period as compared to 4 weeks with Moderna. Next, our Stanford Department of Health. As of today, we have vaccinated approximately 900 individuals. The focus was on our frontline workers, our EMS, our police, our fire, our nurses. These are the individuals who are out there protecting us. We need to make sure that they are safe and they are not vectors for spread within the community. So they're part of that 1A group, and we've been successful in vaccinating as many as possible, and as many as individuals who really wanted the vaccine and the dose. We do begin our second dose starting next week. Again, we issued the Moderna vaccine. 4 weeks later will bring us to Thursday, so we're excited to be administering that. Stanford Nursing Homes began the vaccination program in the first week of January. I've been in contact with some of our nursing homes regarding the program's going very well. Some of the establishments that I spoke to, the residents, it's over a 90% compliance rate, those that want to and those that are physically able to receive it, as well as their workforce. The second dose will begin the end of this month, and again, it's a great moment, and I'm always happy to be talking about something as positive as this vaccination program, because we are moving forward and making sure that our community is safe. So today, a press release was issued. We are issuing vaccines for the 75 and older group. We actually began today issuing the vaccines, and we are receiving numerous requests for the vaccine. And I ask everybody to be patient. And when I say patient, we are administering as many doses as we have, but we are limited. So we are trying to, again, we're always petitioning to get more vaccine. We try to work with the state. But one thing that we're doing here is partnering with Stanford Health. Stanford Health is a great organization in the city, And we are looking to increase the number of vaccinations that will be beginning next week. And we are planning for a rollout this Monday between the city and the Stanford Health, utilizing all of our resources to get as many individuals vaccinated as possible.
And I'll just add that we're already looking to additional sites in combination with Stanford Health or maybe other partners to increase the vaccination opportunities and throughput, again, dependent upon how much vaccination we actually receive. Go ahead, Ted.
Thanks, Mayor. So everyone or every resident wanted a vaccine must have an appointment. There are no walk-ins provided. Again, it's all hands on deck as we run these vaccine clinics. Our nurses are working many hours and they're putting in the time, but we cannot have walk-ins. Again, everything is by appointment. If you want a vaccine, we're asking residents to register for a vaccine appointment. You can go to our website at www.stanfordct.gov/vaccine, complete the registration form. And by last tally, there's numerous residents who have completed it so far. So please go online, register, and we will make sure that everybody who fills out this form will receive a vaccine. We cannot guarantee how soon, but again, we continue to petition and work with the state. We're working with Stanford Health, and we will get everybody vaccinated as the vaccines come in. For those seniors who are having difficulty filling out the form, they can reach out to the Stanford Senior Center at 203-977-5151. And the individuals there, they are volunteers. They are individuals who work in the Senior Center. They will help seniors complete the form. And then registered individuals will be contacted to schedule appointments. And I have to say, as the Senior Center is progressing through this, they're working hard because they're receiving numerous phone calls, but they said it is such a great experience by notifying somebody when they have been chosen for the vaccine. So go online, please register. Again, that's 75 and older population. There's over, I believe, 10,000 residents in that age group, and we want a vaccine as many as we can, as quick as we can. And again, we will do our part in fighting for the vaccine and as much as we can get in a timely fashion.
You know, thank you, Ted. I will say that today I came down to do an interview with one of the news stations and stopped by the clinic that we are operating here to do the vaccinations. And it is very unusual and very rare to see seniors who are happy to come to the government center in order to get a vaccination. It really was a good feeling by them and a good feeling by me. And it is unfortunate that we have such a limited supply that we'll only be able to do a few hundred a day until hopefully next week when we'll be able to push it a little bit further. Thank you very much, Ted. Thank you. We're going to turn to Thomas Madden now, who is our Director of Economic Development, to talk about the stimulus relief bill that was passed by Congress a couple of weeks ago. Thomas.
All right. Thank you so much, Mayor. First off, I wanted to thank everybody who's watching tonight. I want to thank you for supporting all of our local businesses. As you know, Stanford, we don't have a lot of chain businesses here or the big box businesses, and we have a lot of mom and pop businesses. And it's incumbent upon our residents and the surrounding area to make sure that these businesses really survive through the next 6-7 months. From the very start, from the initial CARES Act, the city itself has been lobbying for continued CARES Act stimulus funding from its first bill to the latest bill, and we're continuing to lobby for a third bill. As you know, some of this money will probably expire really by March, April, and the way the vaccinations are rolling out, just getting into the phase 2, phase 3, we may not finish up till the fall. And so we are needing additional money to make sure that we can survive through until we reach that herd immunity. It's also important to remember to everybody that don't let your guard down right now. As you go out to the restaurants, out to the retail, or even into your office, make sure you're following all the proper precautions. Make sure you're washing your hands and wearing your mask. If you do have complaints that you find a business that is not following the guidelines issued by the state, please give us a call. You can do it on Fix It Stanford, or give a call into the city here, and we will send out our inspectors. With that, a little bit going on to the federal COVID stimulus relief. As you know, it's a $1.4 trillion bill. Right, raising up here.
Big numbers, big numbers.
Big numbers. It's really big. Yeah, I've got a lot of the numbers for Connecticut here. So, it's interesting because we have direct relief right now on the bill, which they may be amending. It's $600 for adults. There is some legislation that has been put forward to try to up that to $2,000. And that's for up to a family making $75,000, or adults making $75,000, and $600 for each dependent child. Of course, that goes down as the more money you make. Additionally, they put in $300 additional unemployment benefit through March 14th. And that's to really help us out. The nice thing is as we've been tracking Stanford's unemployment here, we've continuously see the unemployment, the continuing claims dropping. And that means that, one, the stimulus is working, and two, as we have businesses that are opening up with each of the different phases, we're seeing people coming back to employment. The other thing that we've seen in here, and we're hoping that Stanford will benefit from, is there's $68 billion to purchase and distribute the COVID-19 vaccines and to help with the states conducting testing. As you heard from Ted, we're rolling into 1B. There was a recommendation to include essential workers, and this is some of our questions we've been receiving in economic development on what is deemed as an essential worker. We'll be getting out some additional guidance on that from the state. But part of it was looking at grocery store workers or people in the retail and that are frontline that are meeting with a lot of people. And so we'll have additional stuff coming out on that as we start to roll out the vaccination program.
Yeah, just to be clear, we are not yet in phase 1B.
No.
We're in phase 1A, and they've added the 75 and older.
Yep.
I'm guessing, and this is a real guess, that we are 2 to 4 weeks away before really beginning phase 1B. But we'll see, and that's a big new leap. Anyway, go ahead.
So that being said, as the mayor said, one of the things that we'll be doing is we'll be getting that guidance out on how you'll be able to sign up your workers to get vaccinated. Like I said, it's not there yet. We're working through that and with the state to make sure that we have enough of the vaccine. Next slide, sir.
Well, I just wanted to say, I forgot to say something, or Ted forgot to say something, or we both forgot to say something, and that is that the vaccine is absolutely free. You do not have to pay anything for the vaccine here at Stanford, either at the Department of Health or the Stanford Hospital. The vaccine is free, just so you know. But go ahead.
All right, so part of what we see here is the small business relief. There's a $284 billion round for funding for companies that did not receive forgivable the PPP loans early as part of the first round. One thing that they've made some adjustments to is that you can now fully deduct business expenses paid with PPP proceeds. The other one is we've got $15 billion that is being reserved for SOS grants, as they call it, Save Our Stages. And that's the live venue, independent movie theaters, cultural centers that have been struggling. As you know, a lot of the government shutdown that we saw here within Connecticut, a lot of these places, due to indoor facilities and the lack of ability to be able to socially distance, cause them not to open. So again, it's very important that as we move forward, to make sure we save our arts institutions within Stanford, especially within Connecticut, and that money is going to be available for part of, like the Palace Theater or Curtain Call, Avon Theater, because, those are the things that add to really the cultural aspects of living here in Stanford, and we don't want to lose that. There's another $10 billion for childcare centers to help providers safely reopen, and those applications are actually ongoing right now through the SBA. Next slide, sir.
Yeah, but I just wanted to mention that unfortunately, the way the bill was crafted, as I understand it, Curtain Call is not eligible for the Save Our Stages. And that's a disappointment. I have already written to our senators and our congressmen. And just so everyone knows, Curtain Call, it is not does not have professional performers, but it still has a professional staff that operate at full year, and they do a great job for Stamford and for the community and for the kids. And one of the things we're hoping is that that can be adjusted so that they can get additional funds like many other stages across the country.
So yeah, and they did. There was the state also gave out some stimulus relief again for the arts as part of a $9 million drawdown in some of the first original CARES Act. So just to get a little bit into the weeds on this one, so business eligible for the second draw. So if they received or expended or expect to expend into the original PPP loan, you've used all that money, you're eligible to get a second round, but they have put some restrictions on it. So 300 or fewer employees, you can't be a public traded company, and you must show now a reduction in gross receipts of 25% or more during any calendar year in 2020 as compared to the same quarter in 2019. And this is adjusting a few of the things that we saw with the first round of PPE, where you had large corporations receiving large amounts of money, and it wasn't getting itself down into the Main Street businesses. The other aspect of it is you have a choice as well as with the employee retention credit, so on your taxes. They fixed some of the sort of quirks with this, where they were subject to a shutdown order, and they couldn't retain the employees, so they lost part of that tax credit by not being able to get a PPP loan. So again, they've adjusted it, so if a company experienced a reduction in gross receipts of more than 50%, they just need to show that, and they're eligible for the employee retention credit as opposed to the PPP loan. What's interesting, though, is the eligible expenses that they've put into there and made those adjustments. So you're now allowed to include operational expenditures, property damage costs, supplier costs, worker protection costs. They've included group life, disability, vision, and dental insurance, which was not covered under the first round. It was only for wages. And it's still limited, though, to the payroll costs. It must comprise of 60% of the eligible costs. The other thing that they've adjusted is if you had an economic injury disaster loan. So they've eliminated the reduction to the PPP loan. So you could take an economic injury disaster loan and a PPP loan. But if you took both, the PPP loan was reduced by $10,000. They've got rid of that. They've also simplified a lot of the forgiveness applications. So again, if you're up to $150,000, which is a majority of a lot of the businesses, small business that we have here in Stanford, it's a one-page form, no documents to submit, records to be maintained. And this goes through your lender, your bank, and they just resubmit the paperwork back up to the federal government. However, if it's over $150,000, well, no, you still got to submit all the documentation for that, and that hasn't changed. As well, you need to also submit and prepare a forgiveness audit plan if you're over $150,000. So there's a few changes in there, but like I said, a lot of majorities in the businesses that we've seen so far have been able to adapt to the changes and are successfully getting that second round. Next slide, sir. All right, first draw loans were available on Monday. And so if you had not taken a first draw loan, you're able to start applying for that on Monday this week. As of tomorrow, if you need to do a second draw PPP loan, you'll be able to submit those applications through your lender. The SBA has only tweaked the application a little bit, and all the lenders out there right now have those new forms as of this week. If you need additional help, you can call the Economic Development Department here at the City of Stamford. My phone number, 203-977-5168. We're happy to help you walk through some of the questions and conditions, but if not, there's other resources out there. So we've partnered the Connecticut Small Business Development Center, the Women's Business Development Council here in Stanford. Fran Pastore does an excellent job and has been doing lots of webinars on this. The Black Business Alliance, the Spanish American Merchants Association, HEDCO, which is it's a lending institution out of Hartford, University of Hartford Entrepreneurial Center, Women's Business, as well as the Minority Construction Council is available to be able to help you out. So again, there's lots of resources out there. If you need directions on who you'd like to talk to or before you apply, or if you're having trouble with your lender, we have a list of lenders that are out there, and we're happy to share that with everybody. Next slide, sir. So last is, I just want to talk a little bit about, the CT Business Recovery Grant. So this was a grant that got passed in Q4 of last year. It was $35 million in grants to really focus on about 2,000 of the Connecticut's hardest hit businesses, including restaurants and hospitality. The grant sizes ranged from $10,000 to $30,000. There was no application process. This was strictly derived from the tax revenue sources coming from DRS. And checks have been slowly going out, since January 8th. And I've had quite a few phone calls on this to make sure it's not a scam. And so the DACD has been sending emails out and trying to make sure they contact with everybody. I encourage all of our businesses, check your junk mail just in case you did get that email. I know there was over 100 businesses within Stanford who did get these checks and are getting some of that recovery grant money. So again, if you're unsure, again, give us a call here at the city. We can check on it for you to see if you were included in that or not. So again, my phone number, 203-977-5168. You can email me at tmadden@stanfordct.gov, or you can just go to the Economic Development website and hit us up there. And again, we're here to help out our small businesses to make sure that they are getting access to as much stimulus as possible and to make sure that we're doing everything we can to keep our economy up and running within Stanford. So I'll turn it back to you, sir.
Thank you very much, Thomas. A lot going on, and it gets complicated down in the weeds. Again, if anybody needs help, because it is complicated, call Thomas Madden here, and if we can't help you, we'll figure out how to get somebody else to help you. Thank you so much.
Yep.
So just to finish up, before we conclude, just a little bit about the overall numbers. You saw the top lines for the state and the city before. This map on the right is every Thursday. The state of Connecticut updates its coronavirus numbers, and as you can see, virtually every community is red. Last week, virtually every community is red. There's not been a significant change. If anything, it's gotten worse as cases have risen since the holidays. The actual numbers here in Stamford, back in September, October, we were green or not of any color. Then we were yellow. We thought we would go orange, but instead we just tipped over into the red line. And as you can see, it's been rising here in Stamford with our 7-day number. These numbers are a little bit lower than what you saw before because this excludes the nursing homes. It looks like it may be leveling off, but just remember that red is all the way down here. We really have to get back down, at least down to that line. And the truth be known is that we're not going to have a real lifting of restrictions until we get down to at least 5 cases a day or less. And that's not going to happen for some time unless we get much, much more vigilant. Even with the vaccine going out, it's going to take a while for that to make a dent. Remember that if you get a vaccine, you really don't have immunity until at least you get a couple of weeks after that second dose. So it's going to take some time, not just because we don't have enough vaccine, but it takes time even after you get the shot. Got to stay careful. Got to stay vigilant. Here in Stamford, this was our last neighborhood map done between November 22nd to December 19th. Here it is from December 20th to yesterday. Hey, guess what? Coronavirus is everywhere in Stamford, and these numbers across the board are worse than they were during that time period. That is a reflection of the increase of cases that we've had since Christmas and New Year's. But basically, this is so disappointed where the best is actually up in North Stamford and just south of the Merritt with Westover and Turner River. But even those numbers are 4 to 5 times what it takes to be red. And we have some communities which are topping out at close to 100 cases per 100,000. You got to be careful out there. Overall hospitalizations in Connecticut, cases usually are in advance of hospitalizations by 1 to 3 weeks. So our cases are going up, and now we're beginning to see a little tick up in our hospitalizations here in the state. Here in Fairfield County, the hospitalizations have not ticked up. We are still running parallel. I wish these would have gone down, but at least they're not going up so far. And at Stanford Hospital, we've seen actually a slight decrease in the number of COVID patients as of this morning, and a slight decrease in the number of ICU patients. But please know, these numbers change hourly. Regardless, you should know that if you need health care, whether it's for COVID or whether it's for any other severe condition, the Stanford Hospital is the place to go. Do not deny yourself important health care for whatever condition you might have. They keep you safe there, and I encourage you to make certain that regardless of your health condition, if you need help, make certain you get to the Stanford Hospital or to your primary care doctor. We also are looking at the wastewater. You'll notice that the wastewater numbers, for those who understand this, have gone up a little bit for the 7-day average. This last report's a little lower, so maybe that will be a good sign going forward that the cases will begin to drop off. I certainly hope that. But on the 7-day average, we've basically seen the same reflection we've seen everywhere, which is a rise in cases since the Christmas, New Year's holiday. Finally, testing is very robust, and we are finally beginning to do a better job here in the state about getting more testing available, with the lines being a little bit shorter and the amount of time it takes to get the test back being a little bit shorter. We have testing going on all the time, and our testing now is we're doing almost 1,100 tests per day per 100,000. So we're actually doing more than 1,100 tests. We're doing closer to somewhere around 1,400 tests per day in the city of Stamford. And if you think you need a test, and I say this again, if you think you have the symptoms of the flu, or you think you have the symptoms of a mild cold, listen, that's easily confused with coronavirus. If you have any reason to believe that you might have been very much exposed, then go to our website, www.stanfordct.gov/COVID-testing, and that will give you information on where we have testing available. We have some regular sites that are open essentially every day, and then we have other sites that are open several hours every day, but it is improving. And I encourage you, if you have a concern about testing, make certain you get tested. And if you don't have a primary care doctor, then call us, we'll take care of it. If you don't have insurance, call us, we'll take care of it. If you are at risk of coronavirus, then we're all at risk of coronavirus, and your family is at risk. We want to make certain to find out if you or your coworkers or your family might be at risk, because you might have it and not know. On our website, stanfordct.gov, you can always go here for COVID-19 information. I also encourage you, we are sending out a weekly newsletter every Thursday for the e-subscriber. Incidentally, if you didn't get that website address for the vaccines, you can click on this, or it'll be right here on the front for giving you information about how to sign up for the vaccine, to fill out the form so that we can call you back and schedule an appointment. And if you get in there, you know, this is one of the things, health information, including updates on COVID testing sites and vaccine information, is what you would want to check. And there may be other things that we will send out from time to time. You may also want to check so you can get those notifications. The vaccines are coming. And the fact that we have started the vaccines for the individuals who are over 75 is welcome, but we are still only getting a few percentage of the city of Stanford. We are still far, far away. The supply that we receive, I believe we have about 8,500 individuals in Stanford who are over the age of 75. Between the hospital and the city, we won't be able to cover that at the current vaccine levels that we're getting. We won't be able to reach everyone there for several weeks. I am hopeful that the vaccine supply will increase, and that will help for those individuals who are those who are most vulnerable to this disease in terms of the fatalities that are caused. But just because vaccines are coming, COVID-19 is still out there and it's still a concern. And for all of us to protect our family, protect ourselves, you've got to stay true to the basic advice that we've heard so many times. Wear a mask over your nose and your mouth. None of this nose popping out or any of these other strange things. If the science has shown it works, the healthcare professionals and experts across this country have shown over and over again that wearing a mask is probably the single greatest thing you can do to protect yourself and protect your family. It is, if you will, your opportunity as a good person, as a good citizen, to protect others. Of course, the other thing, which I guess maybe is just as effective, is social distancing. Stay apart from one another, particularly when you're in closed environments, at minimum 6 feet apart. And if you're talking loudly or if you be singing, then you need to be further than 6 feet apart. And if you're just passing one another while you're running around the Scalzi track or walking around the cove or wherever it is that you might be outside, maybe in Mayanis Park, to pass one another without a mask for just a moment is probably not at risk. But if you're in crowds, you've got to maintain your social distancing and keep your distance with your mask on. And of course, washing your hands. And my standard is whenever I leave my office, whenever I leave my home, when I come back, I make certain one of the first things I do is wash my hands to make certain that I'm not accidentally bringing that virus and spreading it within my household with the people that I love. And of course, I think it should go without saying, but some people just don't seem to believe it. No large gatherings or parties. That's really the high risk. The high risk thing is getting together and having a party. And listen, this is a little bit like playing Russian roulette. And I'm sorry to be so blunt, but you don't want to be spinning that wheel over and over again. If you keep spinning that wheel, eventually you will get COVID. It is not just that it causes fatalities. It is a painful disease for many, and many have permanently had injuries to their lungs or to their taste or their smell. And you just don't want that, and you don't want your family to have that. So I say good night to you. We will see you again next Tuesday at 6 o'clock. I would tell you one other thing. Every single day, something new is happening with regard to the vaccines or to the testing or to our learning about this disease. Every day there's new information available about grants that are available for our businesses. And in the meantime, we have our lives to live. So as we go forward, we're living a lot of uncertainty. Where we were 24 hours ago is different than we are today. We are responding as fast and as nimbly as we can. But please bear with us, have some patience as we try to bring these life-saving vaccines to you to make certain that you and your family are safe. By next week, I'm sure we're going to have some new rules from the state, but hopefully more vaccine. And by then, hopefully, we'll have a major new opening partnership with Stanford Health, probably at Stanford Hospital, to get more vaccinations to more people. So take care, and we'll see you next week. Stay safe, stay healthy in this new year with all the challenges and all the frustrations and everything that's happened in the past. There is light at the end of this tunnel. Take care.